This is really powerful and I want to share it with you. It's called The 7 Stages of Severe COVID-19. It's an op-ed by a respiratory therapist named Karen Gallardo. Stage 1, you've had debilitating symptoms for a few days, but now it's so hard to breathe you go to the emergency room. Your oxygen saturation levels tell us that you need help, a supplemental flow of 1 to 4 liters of oxygen per minute. We admit you and start you on antivirals, steroids or anticoagulants, and monoclonal antibodies. You'll spend several days in the hospital feeling run down, but if we can wean you off the oxygen, you'll get discharged and you'll survive. Stage 2, it becomes harder for you to breathe, like drowning. The bronchodilators that we give you provide little relief. Your oxygen requirement increases 4 to 15 to 40 liters per minute. Little things like relieving yourself or sitting up in bed become too difficult for you to do on your own. Your oxygen saturation continues to decline and we move you to the ICU. Stage 3, you're exhausted from hyperventilating to satisfy your body's demand for air. We put you on non-invasive positive pressure ventilation, a big bulky face mask that must be velcroed tightly around your face so the machine can efficiently push air into your lungs to pop them open for oxygen delivery. Stage 4, your breathing becomes even more labored. We can tell you're severely fatigued, and ABG confirms that the oxygen content in your blood is critically low and we must intubate you. If you're able to and if there's time, we suggest that you call your loved ones. This may be the last time they hear your voice. We connect you to a ventilator, you're sedated and paralyzed, fed through a feeding tube, hooked up to a Foley catheter and a rectal tube. We turn your limp body to prevent pressure ulcers. We bathe you and keep you clean. We flip you on your stomach for better oxygenation. We will try experimental therapeutics. Stage 5. Some patients survive stage 4, but unfortunately your oxygen levels and overall condition have not improved after several days on the ventilator. Your COVID-infested lungs need some assistance and time to heal, something that an ECMO machine, which can bypass your lungs and oxygenate your blood, can provide, but alas, our community hospital doesn't have that capability. If you're stable enough, we can get you transferred to another hospital. Otherwise, we're going to continue treating you. We're understaffed and overwhelmed, but we're going to treat you the best we can. Stage 6. The pressure required to open your lungs is so high that air can leak into your chest cavity and we insert tubes to clear it. Your kidneys fail to filter the byproducts from all the drugs we're giving you. Despite diuretics, your entire body swells from fluid retention and we need to start you on dialysis. Your long stay in the hospital and your depressed immune system make you susceptible to infections. A chest x-ray shows fluid accumulating around your lung sacs. A blood clot may show up. We can't prevent these from happening, but we can treat them as they present. If your blood pressure drops, we can put you on vasopressors. Your heart may stop. After several rounds of CPR, we'll get your pulse back, but soon your family will need to make a difficult decision. After several meetings with the palliative care team, your family decides to withdraw care. We extubate you, turn off the breathing machine. We set up a final FaceTime call with your loved ones. As we work in your room, we hear crying, loving goodbyes. We cry too, and we hold your hand until you breathe your last natural breath. That's just a little glimpse of what healthcare workers have to go through every single day during this pandemic. Please, get vaccinated.